Hi y'all, Dr. Triffy here. This is my third video in a series on short clips on suicide prevention, suicidal thoughts, how do you manage, what should you do, what should you look for if you feel emotionally overwhelmed, or if somebody in your life appears to be feeling emotionally overwhelmed, or if they're telling you they're feeling emotionally overwhelmed. Today I want to talk about medication, and I did my dissertation using or at least addressing African American women who were experiencing suicidal thoughts and actively harming themselves or had a history of suicide, and to look at how their problem solving styles impacted their level of hopelessness, depression, and eventual thoughts and active attempts to kill themselves. So, one of the things we know about suicide in African peoples, when I say that, I'm talking about African people, I'm talking about West Indian, Caribbean people, I'm talking about African American people. Culturally, we as a group, I hate to generalize, but very often we find that we think we can pray our troubles away. And our first resort might not be to a mental health professional, it might be to go speak to a pastor or a priest when we feel emotionally burdened. We have great support structures in our families and in our extended families, so we tend also to rely on my auntie, my uncle, my godmother, my sister, my play auntie, whatever. And that's great, but if your car's broken, you don't want to take it to your best friend just because you like your best friend. You go to a mechanic, okay? You go to a professional. So I want to encourage you to do that. Number two, medication and depression. Very often we tell each other, even my mom would say, I'll give you about 3 slaps and keep it moving. Sometimes you need more than the 3 slaps. Sometimes your brain needs medication to help it re-regulate itself or to balance itself out. If you were diagnosed with diabetes, you wouldn't just say, okay, give yourself 3 slaps while you're out there stroking or having you're in diabetic coma, right? You need to take your insulin. So it's the same thing. If your depression is at the point where a professional person, in their clinical opinion, has suggested you take medication to help your brain re-regulate itself, that is what you do. There's no shame in that. I mean, do you apologize because you have to take something you have to go to get chemo? Do you make apologies for that? Do you make apologies again if you have to take your insulin shot? It's the same thing for your brain. It's the same thing. So I want to encourage people of African cultures, because it's more a cultural thing. It's a culturally based thing, and we do it on the inside, and on the outside we do sort of present the idea that we're so strong, we got it together, we can handle it, so that when we do show up in medical arenas, people actually do treat us as if, oh yes, we know you're depressed, but you'll be okay. So we are less likely actually to get proper mental health care because of that. So you have to advocate for yourself. You have to put yourself outside. Yeah, you have to go looking, and once you get a recommendation from a professional, follow those treatment recommendations. And if that includes medication, take it, and take it as prescribed. Okay? So I want to continue to encourage you to think better so you can feel better and you can do better in your life. Create the life you want. And sometimes medication has to be a part of that. All right? So peace out. This is Dr. Triffy. Have an awesome day. Go to my website, drtriphi.com. Peace.